Hey guys, this is Dr. Hub. Today we'll look at the high risk infant. So the first heading is the demographic social factors. So under this, it may be related to the marriage age, maternal age, less than the 16 or greater than 40 years. Next is the use of the illicit drugs as well as alcohol and the cigarettes. Next is the presence of the poverty and the unmarried, as well as the emotional and physical stress. Emotional as well as the physical stress. Then we look at the past medical history. As per the past medical history, we check for the genetic disorders. Then comes the diabetes mellitus, writing it as DM. Then hypertension, the asymptomatic bacteria. Then the rheumatological illness is also included. Rheumatological illness. So that is, it can include the lupus. Next is the immune mediated response. Immune mediated response. So immune mediated diseases such as the immunological G crossing the placenta. Immunological G. So it crosses the placenta. Next is, it includes the long-term medications. There is presence of the long-term medications. Now let's look at the other heading, that is in terms of the pregnancies, any previous pregnancies. So you check for the intrauterine fetal death, then also the neonatal death. Look for any case of prematurity, IUGR, intrauterine growth restriction. There's check for the congenital malformation, as well as the cervical incompetence. We look for the blood group sensitization, neonatal jaundice. Next is the neonatal thrombocytopenia. Next is the high drops, as well as the inborn errors of metabolism. The inborn errors, and this is of the metabolism. So next is in terms of the current pregnancy, that is a present pregnancy. So in terms of the present pregnancy, look for the vaginal bleeding. So the vaginal bleeding, it may be a cause of the abruptio placenta. So the abruptio placenta. Next is the placenta previa. Then we look at the STDs or the colonizations. So this includes groups such as the Streptococcus B and the HSV. Then it can also include the chlamydia, the syphilis, as well as the HBV and HIV. Then the present pregnancy, which has the multiple gestations, and in terms of the preeclampsia. Next is the premature rupture of the membranes. The premature rupture. So we are talking about the premature rupture of the membranes. Then comes the short interpregnancy time. So the short interpregnancy time. Next is the poly or oligohydramnios. Poly or the oligohydramnios. And there is also the acute medical or surgical illness. surgical diseases, inadequate prenatal care, then in terms of the familial acquired hypercoagulable states, hypercoagulable states. Next is in terms of the abnormal fetal USG findings. There is abnormal fetal USG findings, and in terms of the treatment of infertility. Now we look at the labor and delivery. So in terms of the labor and delivery, the high risk infants, it includes the premature labor. By premature labor, it means that it is less than 37 weeks. Next is it includes a post-term pregnancy. There is post-term pregnancy that is greater than or equal to 42 weeks. Then comes the presence of the fetal distress, the immature lecithin sphingomyelin ratio. Next is the absence of the phosphatidylglycerol. So there is absence of phosphatidylglycerol. Then is the presence of the breech presentation. Next is the meconium stained liquor. Presence of the meconium stained liquor, and presence of the C-section, forceps delivery, as well as the Apgar score. So this is less than 4 at 1 minute. Now looking at the neonate, the high risk infant, it includes the birth weight of less than 2.5 or greater than 4 grams, 4 kgs, and the birth is less than, the birth being less than 37 or greater than 42 weeks of gestation. Then comes the small or large for gestational age. So small or large for the gestational age. And next comes the presence of the, in terms of respiratory distress, or cyanosis, and in terms of the congenital malformations, then the presence of the pallor, plethora, as well as the petechiae.